A woman in her early 50s was admitted to a hospital because of increasingly odd behavior. Her family reported that she had been showing memory problems and strong feelings of jealousy. She also had become disorientated at home and was hiding objects. During a doctor's examination, the woman was unable to remember her husband's name, the year, or how long she had been at the hospital. She could read, but did not seem to understand what she read, and she stressed the words in an unusual way. She sometimes became agitated and seemed to have hallucinations and irrational fears. What that woman had is now called dementia. So what is dementia? Dementia is not a specific disease. It is a descriptive term for a collection of symptoms that can be caused by a number of disorders that affect the brain. People with dementia have significantly impaired intellectual functioning that interferes with normal activities and relationships. They also lose their ability to solve problems and maintain emotional control, and they may experience personality changes and behavioral problems such as agitation, delusions, and hallucinations. While memory loss is a common symptom of dementia, memory loss by itself does not mean that person has dementia. Doctors diagnose dementia only if two or more brain functions, such as memory, language skills, perception, or cognitive skills, including reasoning and judgment, are significantly impaired without loss of consciousness. What are the different kinds of dementia? Dementing disorders can be classified in many different ways. These classification schemes attempt to group disorders that have particular features in common, such as whether they are progressive or what parts of the brain are affected. Some frequently used classifications are shown in this chart. Some types of dementia fit into more than one of these classifications. For example, Alzheimer's disease is considered both a progressive and a cortical dementia. There are many disorders that can cause dementia, which are described on the following slides. Often the words Alzheimer's and dementia are mistakenly used interchangeably. Alzheimer's disease is the most common cause of dementia in people aged 65 and older. Dementia is a symptom, or possibly a symptom, of Alzheimer's disease. Experts believe that up to 4 million people in the United States are currently living with the disease. 1 in 10 people over the age of 65 and nearly half of those over 85 have Alzheimer's disease. At least 360,000 Americans are diagnosed with Alzheimer's disease each year, and about 50,000 are reported to die from it. In most people, symptoms of Alzheimer's disease appear after age 60. However, there are some early onset forms of the disease, usually linked to a specific gene defect, which may appear as early as age 30. Alzheimer's disease usually causes a gradual decline in thinking abilities, usually during a span of 7 to 10 years. Nearly all brain functions, including memory, movement, language, judgment, behavior, and abstract thinking, are eventually affected. Alzheimer's disease is characterized by two abnormalities in the brain: amyloid plaques and neurofibrillary tangles. Amyloid plaques, which are found in the tissue between the nerve cells, are unusual clumps of a protein called beta amyloid, along with degenerating bits of neurons and other cells. Neurofibrillary tangles are bundles of twisted filaments found within neurons. These tangles are largely made up of a protein called tau. In healthy neurons, the tau protein helps the functioning of microtubules, which are part of the cell's structural support and deliver substances throughout the nerve cell. However, in Alzheimer's disease, tau is changed in a way that causes it to twist into pairs of helical filaments that collect into tangles. When this happens, the microtubules cannot function correctly and they disintegrate. This collapse of the neuron's transport system may impair communication between nerve cells and cause them to die. Researchers do not know if amyloid plaques and neurofibrillary tangles are harmful or if they are merely side effects of the disease process that damages neurons and leads to the symptoms of Alzheimer's disease. They do know that plaques and tangles usually increase in the brain as Alzheimer's disease progresses. In the early stages of Alzheimer's disease, patients may experience memory impairment, lapses of judgment, and subtle changes in personality. As the disorder progresses, memory and language problems worsen, and patients begin to have difficulty performing activities of daily living, such as balancing a checkbook or remembering to take medications. They may become disorientated about places and times. They may suffer delusions, such as the idea that someone is stealing from them, or that their spouse is being unfaithful, and may become short-tempered and hostile. During the late stages of the disease, patients begin to lose the ability to control motor functions such as swallowing, or lose bowel and bladder control. They eventually lose the ability to recognize family members and to speak. As the disease progresses, it begins to affect the person's emotions and behavior, and they develop symptoms such as aggression, agitation, depression, sleeplessness, or delusions. On the average, patients with Alzheimer's disease live for 8 to 10 years after they are diagnosed. However, some people live as long as 20 years. Patients with Alzheimer's disease often die of aspiration pneumonia because they lose the ability to swallow late in the course of the disease. Vascular dementia is the second most common cause of dementia after Alzheimer's disease. It accounts for up to 20% of all dementias and is caused by brain damage from cerebrovascular or cardiovascular problems, usually strokes. It may also result from genetic diseases like endocarditis or amyloid angiopathy, a process in which amyloid protein builds up in the brain's blood vessels, sometimes causing hemorrhages or bleeding and strokes. In many cases, it may coexist with Alzheimer's disease. Unlike people with Alzheimer's disease, people with vascular dementia often maintain their personality and normal levels of emotional responsiveness until the later stages of the disease. People with vascular dementia frequently wander at night and often have other problems commonly found in people who have had a stroke, including depression and incontinence. Lewy body dementia, LBD, is one of the most common types of progressive dementia. Lewy body dementia usually occurs sporadically in people with no known family history of the disease. However, rare family-linked cases have occasionally been reported. In Lewy body dementia, cells die in the brain's cortex, or outer layer, and in part of the midbrain called the substantia nigra. Many of the remaining nerve cells in the substantia nigra contain abnormal structure called Lewy bodies that are the hallmark of the disease. The symptoms of Lewy body dementia overlap with Alzheimer's disease in many ways, and may include memory impairment, poor judgment, and confusion. However, Lewy body dementia typically also includes visual hallucinations. Symptoms such as shuffling, gait walk, and flexed posture, one day-to-day fluctuations in the severity of symptoms. Patients with Lewy body dementia live an average of 7 years after symptoms begin. There is no cure for Lewy body dementia, and treatment are aimed at controlling the Parkinsonism and the psychiatric symptoms of the disorder. Frontotemporal dementia. Frontotemporal dementia, sometimes called frontal lobe dementia, describes a group of diseases characterized by degeneration of nerve cells, especially those in the frontal and temporal lobes of the brain. Unlike Alzheimer's disease, frontotemporal dementia usually does not include formation of amyloid plaques. In many people with frontotemporal dementia, there is an abnormal form of tau protein in the brain, which accumulates in the neurofibrillary tangles. This disrupts normal cell activities and may cause the cells to die. Experts believe frontotemporal dementia accounts for 2 to 10% of all cases of dementia. Symptoms of frontotemporal dementia usually appear between the ages of 40 and 65. In many cases, people with frontotemporal dementia have a family history of dementia, suggesting that there is a strong genetic factor in the disease. The duration of frontotemporal dementia varies, with some patients declining rapidly over 2 to 3 years, and others showing only minimal changes for many years. People with frontotemporal dementia live with the disease for an average of 5 to 10 years after diagnosis. Because structures found in the frontal and temporal lobes of the brain control judgment and social behavior, people with frontotemporal dementia often have problems maintaining normal interactions and following social conventions. They may steal or exhibit impolite and socially inappropriate behavior, and they may neglect their normal responsibilities. Other common symptoms include loss of speech and language, compulsive or repetitive behavior, increased appetite, and motor problems such as stiffness and balance problems. Memory loss also may occur, although it is typically that it appears late in the disease.